related injuries and older Americans who live with chronic medical problems that severely degrade their quality of life. And it's so really, I mean, just, I can't tell you, I think I probably have received more phone calls on this, on doing what we're doing. I don't think I received any calls on the other side of it, but hopefully this reclassification, which by the way polls at 82%, will help many of those patients live a far better life. We're joined today by Secretary Robert F. Kennedy Jr., who's doing a fantastic job, Administrator of Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, the FDA Commissioner, Dr. Marty McCary, Director of the National Institutes of Health, Dr. Jay Bhattacharya, and the Director of the National Institute on Drug Abuse, Dr. Nora Valkow, as well as Dr. Ilana Braun from the Dana-Farber Cancer Institute, Duke University's Dr. David Casseret, the National Commander of the American Legion, Dan Wiley, and my friend Howard Kessler. Howard, how are you feeling? I'm telling you, he looks better than he did 20 years ago. But I don't want to go through what you went through to get there, right? But it looks like you're doing great. I'm proud of you. I want to emphasize that the order I am about to sign is not the legalization, or it doesn't legalize marijuana in any way, shape, or form, and in no way sanctions its use as a recreational drug. It has nothing to do with that. Just as the prescription painkillers may have legitimate uses, but can also do irreversible damage and never, you know, if you look at some of the damage that can be caused, wreck lives, and if it's abused, it's never safe to use powerful controlled substances in recreational manners, and especially in this case, if you take a look, illegal and unregulated drugs, very, very bad thing. So I've always told my children, don't take drugs, no drinking, no smoking, and just stay away from drugs. I have been, they would look at me and they said, Dad, would you stop saying that? I would say it every time I looked at it practically. Young Americans are especially at risk, so unless a drug is recommended by a doctor for medical reasons, just don't do it. At the same time, the facts compel the federal government to recognize that marijuana can be legitimate in terms of medical applications when carefully administered. In some cases, this may include the use as a substitute for addictive and potentially lethal opioid painkillers, and they cause tremendous problems. This can do it in a much lesser way, can make people feel much better that are living through tremendous pain and problems. 40 states and multiple U.S. territories have already recognized the use of medical marijuana. This reclassification order will make it far easier to conduct marijuana-related medical research, allowing us to study benefits, potential dangers, and future treatments. It's going to have a tremendously positive impact, I believe. We're also asking Congress to reconsider its classification of hemp-derived CBD to ensure seniors can access CBD products they have found beneficial for pain and other reasons. Some people are literally dying, and they're dying with tremendous pain, and this can, in many cases, literally stop it. And they have their senses about them, as opposed to painkillers, which don't allow that, don't allow them to die with dignity, frankly. I promise to be the president of common sense, and that is exactly what we're doing. This is really something having to do with common sense. And it's something having to do with the fact that so many people that I respect ask me to do it. People that are having problems, big problems. They are having big problems with illness, with cancer in particular. I now want to ask Dr. Oz to say a few words, followed by Dr. Braun, Dr. Casseret, Dan Wiley, and Dr. Valkow. And we'll sign the order as soon as they're complete, and we'll take some questions. Please, go ahead.
Mr. President, thank you for always bravely pushing for common sense change, as you call it. So President Trump, Secretary Kennedy have been pushing for change. They're passionate in their desire to help the American people, and they have relentlessly pursued this agenda throughout this administration. This also includes a deep passion for research, gold standard research, as Secretary Kennedy also says. But there's another side to the president that often isn't reflected in media reports, and that's the deep passion he has for the people in his life. And he has called me frequently about the people who are calling him, as he alluded to, who are saying that they've got problems and they got relief from some of the solutions we're talking about today. Howard Kessler, who's standing behind me here, was a mutual friend of ours, was an early caller of the president. Many others have ever reached out as well. And Howard's been a passionate advocate for avoiding narcotics, especially in seniors, and particularly seniors suffering from cancer. And that's a population that is a very important one. And it's a sympathetic population that's desirous of trying new ways besides some of the conventional approaches that have been tested by pharmaceutical companies but have untoward side effects. At the beginning of the year, one of the first things the president told me, he doesn't actually tell you, he demanded from me, that my agency, CMS...
Nobody demands from him. Nobody. You have to know him.
That's right. Use the whole tools at his wherewithal to find a better way to help seniors. A passion for a population that has gotten left behind with these discussions. I promised that we would find an answer, even though it had not been done before, and today we are delivering on that promise. Today, our Innovation Center at CMS is announcing a new model and additional actions to give seniors access to cannabinoids. These are CBDs. They're non-addictive, which many are already using to manage pain. There's some clinical evidence that's showing that CBDs provide relief from common conditions that affect Americans, including cancer symptoms and chronic pain and a slew of other problems that affect disproportionately seniors and our veterans. And 6 in 10 people who use the CBDs report that they improve their pain. I think all of those people are calling the president, judged on the number of calls in support of what we're doing today. And sometimes these decisions are difficult, and there's a reason this hasn't happened before. And there's a reason, Mr. President, that every president before you has whiffed on this issue. It's tough. And I know there's going to be a lot of discussion about it. That's why we're so passionate about making it clear that this patchwork that we're working within now, the laws and regulations, they're leaving patients and doctors without adequate guidance on the safeguards of how to use these products, even though they're still being used. At Medicare, we cover 68 million Americans, including people under the age of 65. And they did not have a way of providing these treatments until today. With the president's insistence, that's all changes. The Innovation Center models are going to allow millions of Americans on Medicare to become eligible to receive CBD as early as April of next year, and at no charge, if their doctors recommend them. Thanks to the hard work of the entire CMS team, especially Abe Sutton and Gita Dio at the Innovation Center, the accountable care organizations in this country working in Medicare will be able to provide these products, again, at no cost to patients. Medicare Advantage insurers, and we've been calling them, are also agreeing to consider CBD to be used for the 34 million Americans that they cover. If you can hear my voice and you're over 65, you should pay attention to this executive order because it's going to touch your life. Again, this all becomes active after the first quarter of next year. These CBD products must first meet local and state quality and safety standards. They must come from legitimate sources. They must abide by other regulations of those states. With these boxes checked, patients can be eligible for up to $500 of hemp-derived products each year. This is the first government-led testing of quality and outcomes for patients across different conditions, and it delivers on the need for more data collection and research into hemp usage. CMS is going to collect data, that's our job, on the patients that are being given these products by their physicians. In accordance with all the privacy and security regulations, we're going to analyze that data. We're going to make it publicly available to everybody to be able to analyze with us. If it shows promise, we will expand access to these products to even more conditions amongst Medicare and Medicaid beneficiaries. I want to thank not just the Secretary, but Marty McCary. We want a lot of companies who are doing this research that approach the FDA for formal approval. That is the right way to move forward. And Jay Bhattacharya, who's hiding in the back, he rarely hides, but Jay runs NIH, and he's agreed to support initiatives to study the data that we're collecting. Howard Kessler, God bless you for being a pain in our sides. Mr. President, he's promised to stop calling you. But on this issue, we'll call you on other issues. And I thank you again from the bottom of my heart for taking a difficult stance.
Thank you very much. Okay.
Mr. President, members of the Cabinet, thank you so much for the opportunity to be here and for your leadership in rescheduling cannabis from Schedule 1 to Schedule 3. This decision will accelerate scientific research and expand what can responsibly be studied. I'm a cancer psychiatrist and medical cannabis researcher at the Dana-Farber Cancer Institute. Over the past decade, federal investment in research has helped transform cancer care. People are living longer than ever before. But cancer care is not only about treating the tumor, it's also about addressing the anxiety, the fear, the stress that can come with a diagnosis, symptoms that can interfere with treatment and make recovery much more difficult. Many medications we use for acute anxiety carry significant risks, particularly in the older adults. That's why we're studying specific natural compounds found in cannabis, including the non-addictive cannabidiol, to understand whether they can safely and effectively help manage anxiety during cancer treatment. Rescheduling allows us to ask these questions rigorously about dosing, about safety, and who may benefit most. This research reflects the best of federal investment, helping people not only live longer, but live better. Thank you, Mr. President, for supporting careful, science-based research that puts patients first.
Thank you. Thank you, Doctor. That's beautiful. Thank you.
I'll add my vote of thanks, Mr. President. I never really thought this day would come. I met a patient about 20 years ago, a retired professor named Elizabeth, who came to my clinic. She was dying of pancreatic cancer, and she asked me then whether cannabis might help her. And I said no, because that's what I learned in medical school. She reached into her briefcase, took out a 3-inch tall stack of articles, put them down on my desk, and said, "Really, doctor? You should read these. You might learn something." And I did read those articles, every single one, and found a bunch more. And I did learn something. I learned that there actually is some medical benefit to cannabis that I had not anticipated, never heard about in medical school. Second, I learned that there was a lot we don't know. And third, I learned it's really, really, really difficult to do high-quality, randomized controlled trials of a substance that's federally illegal. This rescheduling has the potential to change all of that and to rewrite the way that we do research related to cannabis in the United States in 3 ways. First of all, it'll democratize the research process so that all academic institutions can participate in research, not just elite academic medical centers. Number 2, it'll give patients and researchers access to highly refined, reliable sources of cannabis rather than relying on 1 or 2 sources around the country. And last but not least, it'll let us do the sorts of large-scale randomized controlled trials that we do in oncology and cardiology. Not dozens of patients, but hundreds or thousands of patients. That's how we learn, that's how we produce valuable knowledge that's useful in guiding treatment decisions. Mr. President, without you, this never would have been possible, and my patients and I and all of our families are grateful. Thank you.
Thank you, Doctor, very much. Thank you very much.
Mr. President, I am Dan Wiley, National Commander of the American Legion, representing 1.5 million veterans. We are the largest veterans organization. We have 2.5 million members of our American Legion family. And I want to start by thanking you for your leadership on this issue. This issue is extremely important to the American Legion, and I want to thank you on behalf of the veterans who are going to benefit from potentially the research regarding this issue. Also want to thank you for your VA Secretary, Secretary Collins, and his work on difficult veterans issues with us this past year. The VA has worked with us on our Be the One mission, which is a mission to fight the epidemic of veteran suicide. Veterans are disproportionately affected by conditions such as PTSD, TBI, depression, and chronic pain. And with this reclassification, it will allow research to be conducted with regard to cannabis. There is anecdotal evidence that cannabis benefits these conditions, and now we'll have an opportunity to see if research does prove that it is effective. And if it is so, then it'll open up a whole new method of treatment for our veterans with regard to this particular issue. And so, again, I just want to thank you for your leadership and thank you on behalf of the American Legion for this executive order.
Thank you. Such great people
Thank you very much,
that
Mr.
have
President.
suffered and will suffer a lot less now.
You're right.
Based on what I hear.
Good
Anybody
afternoon.
else, please?
I'm Nora Volkov. I'm Director National Institute on Drug Abuse. And for us, the rescheduling opens the door to actually be able to accelerate the rate at which we can do research and discovery. And research is crucial in order for us to, for example, understand what may be and for whom the dangers of cannabis. Yes, cannabis can be addictive, and certainly people, adolescents and children may be the most vulnerable. But we cannot close our eyes to research and the opportunity that we are hearing from patients that for some of them, cannabis can solve their problem. And so what we need to do is do research, number one, to understand what are those conditions. Number two, in order to be able to optimally learn how to use it. And to understand, number three, who is at danger. And it is knowledge that will allow us to optimally take the benefits that may be behind cannabis, as research shows, but on the other hand, also enable us better to do prevention interventions to protect those that are most vulnerable. So thanks very much.
Great job. Thank you very much. Thank you, Doctor. Bobby, do you have something to say?
I'll just echo, thank you, Mr. President. Thank you for your leadership and vision in finally getting to closure on this issue. This is a question, a scientific